Welcome to the State of Vermont's Children Briefing. My name is Dr. Morgan Crossman, and it's my honor to serve as the Executive Director of Building Bright Futures, which is Vermont's Early Childhood State Advisory Council. And we're really thrilled to be here today to show you the most up-to-date, high-quality data on the well-being of kids and families in Vermont. Title 33, Chapter 46 is what names Building Bright Futures as the primary advisor to Vermont's governor, the legislature on the well-being of children and families in the state of Vermont. This statute also requires BBF to produce the State of Vermont's Children Report annually as a tool for our legislators, policymakers, and invested leaders, and really using that data to make informed decisions about early childhood policy. So I want to take 1 minute to celebrate that this is BBF's 10th year of producing this critical data report. So as many of you know, Vermont does not have an integrated early childhood data system where you can look at all of the data across sectors and topics in one database. And so this report serves as that critical compilation and repository. And we also have the ability to do that through Vermont's Early Childhood Data and Policy Center at vermontkidsdata.org. I know that I, alongside my entire team at Building Bright Futures, are so proud to be part of the legacy of producing this report and using it as an opportunity to strengthen and transform the way we think about and use data to inform early childhood policy. So thank you to my team. Thank you to the BBF network and all of our incredible data stewards and partners for 10 years of building Vermont's capacity to prioritize data-driven decision-making in the early childhood arena. I don't have time to thank every single person individually, but I do want to draw your attention to page 42 of the report, and that includes a full list of all of our different data stewards from both public and private entities, as well as all the teams of people who have contributed to this report. So thank you for your work and thank you for your partnership. I want to lastly thank some of our families who have provided photos of children and families for our presentations and reports. To me, I truly believe that those photos are helping us make the data real. They're reminding us that this is about Vermont kids and families and that our work should be centered on really thinking about improving their well-being. So thank you for joining us today. Today's briefing is going to start with a mindful moment that reiterates our collective vision for Vermont's early childhood system. And then you'll hear a very brief presentation about our data. So you'll hear about some of the demographic characteristics, mental health, child development and education, as well as basic needs. It's important to know that we are not able to present every single indicator or data point that's in the report in the briefing today, because the report actually has over 100 indicators on the system of services and outcomes for kids and families. You'll also hear about our recommendations from the State Advisory Council network, and then we'll talk a little bit about housing as a critical basic need in our system. Today's presenters are going to include the BBF data and policy team, and that is Beth Trzanski, who is our Deputy Director, Dora Levinson, who is our Research and Data Director, Anna Burlett, our Policy and Program Director, and Nicole D'Agostino, who is our Data and Policy Manager. We've also invited Paul Dragon from CVOEO, who serves as one of our State Advisory Council members, and then Sarah Phillips from the Office of Economic Opportunity at the Department of Children and Families to speak about the public and private efforts to support children and families in accessing housing and making it more affordable. A couple of housekeeping notes for today's discussion. As you're listening today, please feel free to submit questions or comments in the chat bar, and that will be shared directly with all of the panelists on the call. And then we're also happy to take questions a little bit later in the briefing at the end, and happy to connect with you after the briefing if we weren't able to answer those questions. Today's briefing is being recorded, and the recording, slides, report, and policy playbook are all going to be accessible through our website this afternoon. So let's jump into our mindful moment.
Let's jump in. To set the stage for today's briefing, our mindful moment includes the vision for Vermont's early childhood system outlined in the Vermont Early Childhood Action Plan. I'd like to ask you either to close your eyes or focus on the slide on the screen, and I want you to, as I walk you through the vision and goals. In the year 2026, a child is born to a family in Vermont. We will call her baby Mariah. Vermont is a state where all children and families are accepted for who they are, Mariah and her family are supported from the very start all the way through her development and education. Mariah thrives with the loving care of her family. Their home is warm and safe. There is food in the fridge today and on the horizon. The whole family is connected to their diverse community and can access high-quality opportunities that meet their needs. Mariah grows into a toddler, preschooler, and eventually transitions into the local elementary school. She is resilient and able to navigate even the difficult days she will face. Mariah does not yet know that there's a community holding her and her family through a seamless early childhood system. This is a system where all children have a healthy start, where families and communities play a leading role in children's well-being, where families have access to high-quality opportunities that meet their needs, and where the early childhood system is integrated, well-resourced, and data-informed. This is the future. This afternoon, as we talk about the current state of children and families, I'd like you to hold on to this vision and to reflect on where we are now and where are the opportunities to move even a step closer to that vision. Now that we're oriented to the vision we've set for the early childhood system, it's important to understand BBF's role in supporting the system. So let me do that briefly. Building Bright Futures is Vermont's early childhood public-private partnership charged under Vermont Title 33, Chapter 46, and the Federal Head Start Act as Vermont's Early Childhood State Advisory Council. We call it the SAC. The mechanism used to advise the governor and legislature on the well-being of children in the prenatal period all the way through age 8 and their families. The mission of Building Bright Futures is to improve the well-being of each and every child and family in Vermont by using evidence to inform policy and bringing voices together to discuss critical challenges and problem solve. BBF maintains the vision and strategic plan for Vermont's early childhood system and is charged with holding our partners and system accountable to child, family, and system outcomes. BBF's network infrastructure includes each level you're seeing on this slide on the left of the screen. We start with holding children and families at the center of all we do and commit to using evidence and data to drive decision-making. There are 12 regional councils touching every corner of the state to identify needs, 7 VCAP, Vermont Early Childhood Action Plan committees to hone in on specific policy topics and to monitor the VCAP, and the 23-member governor-appointed State Advisory Council members charged with setting priorities and making recommendations. Today's briefing, the State of Vermont's Children Report and Vermont's Childhood Data and Policy Center are critical ways BBF makes our key mandate in Vermont statute for monitoring the early childhood system and advising the governor, administration, and legislature. It's important for us to understand where we are now and and what to watch for in the future by reviewing the data. So thank you for joining us today. While this year's report and briefing is by no means exhaustive, it will cover a snapshot of important indicators to watch for the coming year and to help inform priorities for the coming legislative session. If you have questions, comments, or have found an error, please do not hesitate to reach out to us at data@buildingbrightfutures.org. We will do our best to answer your questions and connect you to experts who may have more to share. I'm going to hand this over to Nicole.
Good afternoon. We want to briefly discuss data limitations on the report. We do our best to present the most high quality, up-to-date data available as of December 2022, and we strive to put forward the best data possible in the report. But there are some limitations worth noting in the data that you'll see in the coming slides. These include proxy measures, timeframes, age ranges, the COVID-19 pandemic, data sources, and data steward capacity. For more information about limitations, please see page 38 of the report. We'll be reaching out to regional partners in the coming months about this data, and we'll be happy to discuss more in depth. So let's get into some highlights from the latest State of Vermont's Children. Apologies about that. So who are Vermont's young children? When decisions regarding policy and funding are made, it's important to understand who will be impacted in order to protect vulnerable children and their families. Here are some examples of data to consider. There are 60,364 children under the age of 10 living in Vermont, including 5,073 babies born in 2021. 55% of these children live in 4 of Vermont's 12 regions, with a full 1/4 living in Chittenden County alone. Although the vast majority of Vermont's population identify as white, the state is growing more racially diverse, especially among young children. This table shows that the percentage of the population under the age of 10 who identify as 2 or more races or multiracial is at 4.4%, which is more than twice that of the Vermont population as a whole at 2.1%. Similarly, 3.2% of children under the age of 10 identify as Hispanic or Latino, compared with 2.2% of the population as a whole. 30.4% of children under the age of 12 live in households with incomes below 185% of the federal poverty line, which is the benchmark for qualifying for many benefit programs. 541 children under the age of 9 are living in out-of-home protective custody, while 9,258 children under the age of 18 are living with grandparents or other relatives. Now I hand it over to Dora for more highlights.
Thank you, Nicole. In last year's report, our data spotlight was on Vermont's early childhood workforce crisis. Unfortunately, the vacancies and turnover rate have not improved since then. For designated mental health agencies and specialized service agencies, there was an 18% vacancy rate in the fall of 2022, which was slightly higher than it was in the fall of 2021, and almost twice that from the summer of 2020. In Head Start and early Head Start programs, 17% of staff left during the last program year, with more than 1/3 of those positions left vacant for more than 3 months. In terms of regulated childcare, there were 16% fewer individuals working with children in December of 2021 than there were in December of 2018. These workforce shortages in critical early childhood settings have ripple effects throughout the many resources, services, and supports for Vermont children and their families. In last year's report, we also identified several mental health indicators as data to watch over the next few years. Like most of the information we are presenting today, we still do not know the full impact of the pandemic. However, as you can see here, between 2018 and 2021 in Vermont, there has been a 60% increase in the proportion of children ages 3 to 8 with an emotional or mental health condition, including anxiety, depression, and a behavioral or conduct problem. This 60% increase is even more striking when compared to the US as a whole, which did not change during the same time period. There's also ample anecdotal evidence that the need for children's mental health services is increasing, not only in the number of children requiring services, but also the acuity of those needs. However, as you will see, the utilization of services is not necessarily matching those increases. Vermont's mental health system has multiple levels of, can you go back one slide? Thanks. Vermont's mental health system has multiple levels of supports and services, from outpatient and community-based supports to crisis management, inpatient care, and residential treatment. However, a key part of this continuum is missing. As you likely know, prevention is more effective and less expensive than treatment. However, 2 critical federal resources, Medicaid and the Mental Health Block Grant, cannot be used for prevention and the promotion of mental health activities. Medicaid requires a diagnosis for services, and the Mental Health Block Grant can only be used for youth with severe emotional disturbance. The lack of federal funding for upstream prevention and promotion services is impeding Vermont's ability to turn the curve on wellness. For those with a diagnosis, Vermont's 12 designated mental health agencies, or DAs, provide both routine mental health services and crisis services for those children needing immediate care. In this chart, the dark blue bars show the number of children receiving routine mental health services, and the light blue line shows the number of children receiving crisis services. When the two indicators are taken together, the data show that when there are fewer children receiving routine services, the number of children accessing crisis services is higher. While awaiting a placement, children with a primary mental health diagnosis may end up boarding in an emergency department. In 2019, there were 1,500 discharges from emergency departments for children with a primary mental health diagnosis, and 16% of those children waited 2 or more days for a placement. These placements can include residential treatment. However, locating a bed for children is increasingly difficult. Vermont currently has the lowest number of out-of-home treatment beds in over 2 decades. In addition to full program closures, some programs have had to temporarily close beds or shift from 7 to 5 days of operations per week. All of these trends continue to be important to watch as we support children and families in recovering from the ongoing impacts of the COVID-19 pandemic. We are at a critical moment in the continuing public health emergency of early childhood mental health, a moment which will have long-term consequences based on our action or inaction. I'm now going to pass it over to Morgan, who will walk us through some of the data on child development and education.
Thank you. So Vermont's early care and education system is considered what we call a mixed delivery system. And that's defined by the Every Student Succeeds Act as a system of early childhood education services that are delivered through a combination of programs, providers, and settings. And that may include Head Start, licensed family and center-based childcare programs, public schools, and community-based organizations. And this system is supported by a combination of public and private funds. This approach is considered a national best practice because it's improving access to high quality services. It supports family choice in providing this range of options through settings. And it's really important in a rural state like Vermont. It also builds our capacity to serve a greater number of children. So the next couple of slides are going to show us the current status of our mixed delivery system. So the current slide shows us a little bit about regulated early childhood education settings. So as of December 2021, there were 16,381 children enrolled in regulated early childhood education programs. And the majority of those children were receiving care in center-based programs. You can also see here that the number of preschoolers enrolled is higher than the number of infants and toddlers. As we're thinking about quality and access in this mixed delivery setting, 76% of infants, 54% of toddlers, and 52% of preschoolers that are likely to need care do not have access to high quality programs. Our partners at Let's Grow Kids have reported that in order for Vermont to meet the estimated demand, approximately 9,000 new childcare slots are needed, and that a lot of those, over half of those, would be dedicated towards infants. As we're thinking about building a truly comprehensive system of services for infants, toddlers, and our early childhood system, it's important not to forget about after school and out of school time care. So according to our partners at the After School Alliance, in 2020, there were 19,092 children in after school programs in Vermont. But they also found that if an after school program were available to them, over 26,000 of Vermont's children would likely participate. It's also important to mention some of our wraparound services that we have in Vermont. This is not on your slide deck, but in terms of those wraparound services, there's so much support that children and families are receiving through programs like Children's Integrated Services, the Parent-Child Center Network, Head Start and Early Head Start, and Reach Up. So we want to bring you back to the report for information on the number of children served in those programs, as well as the impacts of those programs. So as we move through this mixed delivery system, I want to draw your attention to universal pre-kindergarten education, which is coming through Act 166. And this is providing access to 3, 4, and 5-year-olds not yet enrolled in kindergarten access to 10 hours a week of universal pre-kindergarten education in school-based or private programs. And so what you're seeing here is an overall trend for enrollment. And what you're seeing in 2020 and 2021 is that that was when the pandemic hit. So we see a slight drop in enrollment in that year. And in 2022, you're seeing that rebound a little bit up to about 7,500. So we're not quite back to pre-pandemic levels, but we are working with our agency leaders at both agencies to examine the current enrollment and capacity trends for our public and private programs to see what we need to be thinking about coming into this legislative session. Next, I want to draw your attention to one of the key outcomes that we use in the early care and education system to understand the impact of services. And that's third grade math and reading. So on the far left of this visual, we're seeing that 41 and 42% of all students were proficient or above in math and reading, respectively. However, those proficiency rates are varying significantly by child and family characteristics. So for example, the percentage of children who are considered historically marginalized, it's much lower than the percentage of students considered historically advantaged. To wrap up this section on early care and education, I want to transition to talking about data on exclusionary discipline. And this has been a heavy focus in the last 2 legislative sessions. The passage of Act 35 prohibited suspension and expulsion for children under the age of 8. And in this last year, BBF partnered with the Vermont Agency of Education to produce a data brief that outlined all the existing data for children under the age of 9. And it outlined all the limitations and challenges, as well as considerations for policy. And that's available at vermontkidsdata.org. But to outline some of the key findings, I think one of the most important things for people to know is that the quantitative data for children under the age of 5 is not reportable. And that's because there are extremely low or small numbers that have to be suppressed in order to protect children's confidentiality and privacy under HIPAA and FERPA laws. But what we can show you as we're looking at data on children ages 5 through age 8 is that suspensions appear to increase as the age of the student increases. And if you look specifically at the last 2 series of columns between the 2020 and 2021 data, the number of suspensions decreased for students that are age 6, 7, and 8. While for 5-year-olds, the number of suspensions more than doubled. So that's the 2 dark green bars in the 2020 and 21 data. It's also important to note that our most vulnerable students are excluded at higher rates. And 2 examples of that are that students who are eligible for free and reduced lunch make up 35% of the student population, but they account for an average of 72% of suspensions. And our children who are receiving special education services, which make up about 15% of the overall student population, account for 36% of suspensions. So for our last data section, I'm going to turn it back over to Dora to talk about basic needs and housing.
Thank you, Morgan. There are many different ways to quantify the cost of living for families in Vermont. We often hear about the federal poverty level, but it's actually a national guideline used to determine eligibility for programs and services rather than a metric for poverty. In fact, eligibility for programs often uses 185% of the federal poverty level as a guideline rather than the actual federal poverty level. Another metric is the living wage calculator from MIT, which produces an estimate for every state in the country of the wage needed to meet a household's basic needs. This wage level does not include funds for savings, emergency expenses, or expenses like meals in restaurants. It also does not include potential benefits that families may access depending on their income. A family of 4 in Vermont would need an annual income of almost $110,000 to meet these basic needs. This chart also shows several additional metrics for a family of 4 living in Vermont. As you can see here, even the median household income does not meet the living wage, let alone the earnings from 2 adults working for minimum wage or families receiving the maximum reach-up benefit. I also want to acknowledge that the living wage calculator does not account for the inflation of the past year. On average, between January 2021 and September 2022, Vermont households were paying 11% more per month for goods such as food, shelter, transportation, and energy due to inflation. This year's report includes a spotlight on housing and homelessness. During the past year, housing concerns, challenges, opportunities, and priorities arose at every level of the BBF network, necessitating both a deeper dive into the data and resulting in recommendations from the State Advisory Council. Our two guests will speak in a few minutes from their public and private roles about the housing crisis, but I do want to share a few key indicators to set the stage. There are many challenges with both availability and affordability of housing in the state. 32% of households in Vermont spend 30% or more of their income on housing. For renters, this burden is even higher at 50% of households. In addition, Vermont's rental vacancy of 2.4% was the lowest in the country, so finding any rental, let alone an affordable, desirable rental, can be extremely challenging for families. While homeownership provides a path to building financial assets for families and gives children a secure, stable housing situation, given the low homeowner vacancy rate of 0.6%, paired with soaring interest rates, many Vermont families are finding homeownership increasingly out of reach. When we look to those who are unhoused, the impacts can be significant. The trauma of any period of homelessness, even short-term, can have a major effect on future development. Children who experience homelessness may have significantly higher rates of emotional, behavioral, and both immediate and long-term health problems. Like metrics for the cost of living, there are multiple ways of defining homelessness and housing insecurity. The McKinney-Vento Homelessness Assistance Act defines homelessness and housing insecurity as lacking a fixed, regular, and adequate nighttime residence, which includes sharing the housing of other persons, living in temporary housing, and places not designed for regular sleeping accommodation. Children and families meeting this definition are entitled to a number of services, resources, and supports from their local education agency. As you can see here, there has been a striking increase in the number of homeless children under 9 enrolled in school, from 247 in the 2020-2021 school year to 398 in the 21-22 school year. Similarly, the January 2022 point-in-time count of those experiencing homelessness shows the number of people in households with children increased by 130% from pre-pandemic levels. Anna will now take us from this exploration of data into the recommendations of the State Advisory Council.
Wonderful. Thanks, Dora. The next section of this briefing will focus on the 2023 policy recommendations of the Vermont Early Childhood State Advisory Council Network. The annual policy recommendations are developed with input from across all BBF network gatherings throughout the year. This includes VCAP committees, regional councils, the State Advisory Council network itself, as well as countless other partners and stakeholders throughout the network. Overall, these recommendations seek to identify the current gaps and needs in the early childhood policy system. They promote action in strategic areas for the coming year, and they provide recommendations that are measurable and ultimately aim to move Vermont towards a more equitable early childhood system. The 2023 policy recommendations are framed around the 4 foundational goals of the Vermont Early Childhood Action Plan, or VCAP. On the screen here, you'll see broadly this year's recommendations fall into the following policy areas. I encourage you to read the report, pages 4 through 6, as well as visit the BBF website to read these more in depth. However, this year's recommendations include focusing on the value of care coordination, housing as a critical basic need, elevating and compensating lived experience and family voice,
priorities related to early childhood education workforce, as well as quality early childhood care and education, priorities related to the mental health workforce, services and trauma and resilience training, collective legislative action and monitoring and accountability in the early childhood governance in Vermont, and finally, inequities in data collection and reporting. Again, we encourage you to visit the website or read the report to see the details of each of these. Today's briefing will focus on one of these urgent policy areas, housing as a critical need. Next, I'm going to focus on why these recommendations are important and their value within the BBF network and more broadly. And while the policy recommendations are leveraged in a variety of ways by stakeholders from across sectors, their foundational goal is to provide a common agenda and unifying vision for the state's early childhood system and its partners. The policy recommendations also intend to elevate urgent statewide issues and priorities that need to be addressed by the BBF network or more broadly by the system at large. They also provide common language to inform decision-making and support partners in their advocacy efforts, and seek to communicate across sectors about early childhood needs and priorities to key decision makers. They also work to validate the work of VCAP committees, regional councils, the SAC, and others doing critical work to support the well-being of young children and their families. And finally, they really seek to create accountability for policy change toward the vision articulated in the Vermont Early Childhood Action Plan. Next, I'm really excited to introduce and hand the floor over to public and private partners whose teams are working to address and collaborate on one of the critical policy areas elevated by the policy recommendations, supporting families and children with accessing housing. We know that housing is a basic need for all Vermonters. The impact of being homeless can be particularly detrimental to young children. The trauma of homelessness, even short-term, can have a major impact on future development. First, we will hear from Sarah Phillips, the Director of the Office for Economic Opportunity at the Department for Children and Families. Sarah will provide more information about and data on the Family Supportive Housing Program, in addition to sharing some of the other priorities and programs her team holds. Then we will turn to Paul Dragon, the Executive Director of the Champlain Valley Office of Economic Opportunity and a member of the SAC. Paul will elevate the challenges and critical needs facing Vermont families and their children when it comes to finding and affording housing in our state and some of the strategies to alleviate these challenges. Sarah, I'll turn the floor to you.
Thank you, Anna, and thanks to my colleagues at Building Bright Futures and to the Council for their focus on housing and homelessness. I wanted to start by zeroing in on why it's so critical to think about housing and homelessness when we think about childhood well-being. And the U.S. Interagency Council on Homelessness produced a wonderful policy statement on ending childhood homelessness. I encourage others to read. I've included the link here. But a few pieces that they highlight and that you've made mention of. First, the first thing to note, and this is true in Vermont as well, is that people are more likely to experience homelessness in their first year of life, and also next most likely under the ages of 6. In other words, if you look at everyone who's experiencing homelessness, it tends to be the largest group as well. In fact, half of our children in shelter are under the age of 6, and most of our families experiencing homelessness in the state of Vermont have very young children. And finally, it's not even for young children, but it's known that homelessness itself during pregnancy and in the early years is harmful to children's development. And pregnant women experiencing homelessness are less likely to receive adequate prenatal care. You can imagine for all the reasons it would be hard to access care, and their children are at increased risk of low birth weight. And we know that those things really matter in terms of the impact on child development. So I wanted to talk a little bit about what we're doing at DCF towards the goal of solving family homelessness. Next slide. Great. So there's really kind of 3 high-level strategies that we're really focused on at DCF when it comes to solving family homelessness. One is prevention both providing flexible financial assistance, but also supports to help families avoid becoming homeless in the first place. You saw the data on the vacancy rates and the challenge of finding and accessing affordable housing. For that reason, it becomes even more important that we help families who are struggling to stay in the housing that they have. The second is a strategy called rapid rehousing, which is to help families who are currently experiencing homelessness access the rental assistance that they need to get on their feet and then help them bridge to long-term affordable housing. Combined with rapid rehousing with that rental assistance is some supportive services to help connect them to healthcare and employment and other services. And then the third strategy is permanent supported housing, which is long-term intensive home-based service coordination to help families with the most complex needs. In other words, those working with a lot of other service providers already to help find and keep them housed, recognizing that housing stability is the foundational for helping families to grow and succeed in other ways. Next slide. I wanted to highlight a few of the specific programs that speak to those strategies that we're working on at DCF. One, as mentioned, is that the Office of Economic Opportunity at DCF administers the statewide Family Supportive Housing Program. This program provides intensive case management and service coordination for families with complex needs who've experienced homelessness. We work with 9 different community-based service providers around the state, and those organizations partner with affordable housing agencies. They work to help families experiencing homelessness access and get into permanent housing, and then they stay with them over the long term to help them keep that housing and address underlying root causes for their homelessness. Last year, the program worked with 368 families, and 60% of the children served by the program are under the age of 6. Family supportive housing is prioritized to support families who experience child welfare involvement, families with young children, and families with multiple episodes of homelessness. It uses an evidence-informed practice framework developed by the Center for Study of Social Policy and the Corporation for Supportive Housing. And in state fiscal year 2021, we actually were able to expand the program from 7 districts to 10 Agency of Human Services districts, or 10 counties or communities. We nearly doubled our ability to support families, and we now have a caseload of 285 families at any point in time. You'll see, though, that we're not yet statewide, and there are still families that could benefit from family supportive housing. Rapid rehousing vouchers. So during the pandemic, we made use of some one-time funding from the U.S. Housing and Urban Development Program to help 262 families statewide exit homelessness into permanent housing. We paired that with temporary rental assistance administered by our partners at the Champlain Valley Office of Economic Opportunity and using local organizations to provide support. The vast majority of those households were able to transition to a permanent housing choice voucher, or what's known as a Section 8 voucher, meaning that their housing will continue to be affordable for them. Building off of the success of that program, we're really excited this week that we're partnering again with CVOEO to launch what's called the Home Family Housing Voucher Program. And 100 families experiencing homelessness will receive a temporary voucher to help them exit homelessness. The governor has actually proposed in the Budget Adjustment Act an additional $3 million for this to expand this project. Next slide. Oops. Maybe I'll just jump in one more, even though there's not a slide, to highlight some housing supports for Reach Up. So we have also expanded the use of rental assistance to support households in the Reach Up program with the use of the Emergency Rental Assistance Program. And this has been an important way to ensure that families with very low incomes can have affordable housing. And that program, our project was supported again with U.S. Treasury funds, will continue in through June of 2023. Thanks. So with that, I want to make sure that I hand it over to Paul Dragon, my colleague at CVOEO, who's going to talk a little bit more about some of the work we're doing together and some of their other work around family homelessness.
Thank you so much, Sarah, and congratulations to my colleagues and community members, advisory committee members at BBF for this great report. There are many, many variables to child well-being, and we know that housing is absolutely fundamental And the good news is that it's possible to solve child homelessness with relatively modest strategic investment. So when we look at the last few years of child homelessness in Vermont, you can see at 2016 for the point in time count, we had a 28% reduction in the number of homeless individuals statewide. That was the largest one-year decrease in the nation in 2016, and Vermont was recognized for that decrease. At that period of time, we had 156 households with children, or 20% of total households counted. And so we saw the increase happen, due to the pandemic, the economy, and in 2022, we saw the numbers shoot back up from 629 households in 2019 to 857 in 2022. And now today, we have approximately 400 families and 500 children experiencing homelessness. So we're going back into the right direction. And that is really, really good news. Some of the data around child homelessness was already presented. We know the risks: higher levels of emotional and behavioral problems, increased risk of serious health and chronic health conditions. Children are more likely to experience separations from their families, more school mobility, repeat grade, lower academic performance. And yes, as has been mentioned, they're more likely to experience homelessness as adults. We know that one of the major challenges here, particularly in Vermont, and it's already been mentioned, is the vacancy rate. So we know it's about a 2.4% vacancy rate. We know in Chittenden County, it's extremely, extremely low. And we know that a healthy vacancy rate is anywhere from 5 to 7%. There's been a lot of good work with Governor Scott's administration, with our legislators and our housing providers all around the state. And there's plans to build more affordable housing, and that is great news. And we absolutely need to do that. When we think about homelessness in general, I know our intention as a state is to solve all of homelessness. I think particularly with the housing challenges, and as we begin to think about immediate steps to solving homelessness, solving family homelessness is doable, even with the current vacancy rate. And I just learned this morning about the extra $3 million for the housing voucher program for families, and that is wonderful news, and it is absolutely a great step in the right direction of solving child homelessness. Next slide. So we think we can do it now in the two or three coming years, and that is what we can do is what we just started to do, as Sarah's talking about, is invest in rental supports for up to 18 months to rapidly rehouse and stabilize families. We can build on current and successful models like family supportive housing to provide direct service and help coordinate services, including prevention for families experiencing homelessness. One of the things that I hope we can do is also revisit Vermont's roadmap to end homelessness. That was a 2016 document that we had contracted out and had a lot of support from housing providers and service providers all around the state. And I think revisiting that would be really important as we continue to move forward with solving all homelessness. Let's reconvene the Vermont Council on Homelessness, and let's reconvene the Child Poverty Council. Both were very successful. You saw the numbers for 2016. We had made great advances in solving homelessness. Next slide. One of the things that is important for many of us in here at CVOEO, where we have fair housing and the Vermont Tenants Program, is Vermont has no cause eviction, as many folks know. So we get calls every week on our hotline with families, and they don't know why they're being evicted. So again, it's a pretty low cost or no cost intervention. If we could revisit just cause eviction, which includes a right to counsel, That is a great way to help families stay housed, along with mediation efforts, supports for the landlord, and landlord liaison work. We think this is an important component of prevention. Next slide. So along with more affordable housing, more support services for families experiencing homelessness, we also know that mobile homes can be used as affordable housing. So creating more cooperative ownership opportunities and strengthening existing advocacy and organizing is really, really important, including helping to rebuild and strengthen the infrastructure of mobile homes is important. We talked about the many variables that lead to child well-being. Well, certainly housing is fundamental and the food system is fundamental. We know that 2/5 of Vermonters are food insecure. So we've been doing a lot at CVOEO and throughout the other Vermont community action programs to really rethink the charitable food system and think about more mobility, more outreach, food choice, food that is tailored to health conditions. We think that is a really important connection to the fundamental issue of housing and homelessness. And you know about the access to broadband and technology, how important that is for families and access to affordable childcare. So I just want to say, Morgan at the beginning and Beth asked us to think about that ideal state for a child and a family. And that is a journey that we're on. I think there's good news. I think we're moving in the right direction. And I think it's important that we continue to move towards that North Star and we can really, really solve child and family homelessness. Thank you.
Wonderful. Thank you both so much. We really appreciate you joining us today and sharing more about your work. Next, I'm going to pivot us to look at the specific policy recommendations of the BBF network that were endorsed by the State Advisory Council this year related to housing. You'll see those here on the screen. They include invest in housing programs and resources that expand availability and promote affordability and equity in Vermont's rental and real estate markets by means such as expanding the Family Supportive Housing Program and protecting manufactured home communities by investing in infrastructure repair and maintenance. The second overarching goal here is support families who are unhoused or experiencing housing transitions by investing in trauma-responsive shelters, transitional housing, transportation resources, and related staffing, and ensure children are able to attend school in their home districts if preferred. Next, I want to highlight how partners use BBF's policy recommendations to create change and impact their work. The following are examples of ways early childhood stakeholders across Vermont have used and can use the policy recommendations to support their work and improve the well-being of children and families. Folks such as legislators, the administration, and early childhood leaders can reference the policy recommendations as well as the Vermont Early Childhood Action Plan when considering things such as funding allocations, formulating their priorities, and developing legislation. Additionally, early childhood stakeholders, program administrators, advocates, and family leaders can reference the policy recommendations alongside the Vermont Early Childhood Action Plan in legislative testimony or when advocating for change in a variety of settings. Finally, public and private early childhood program administrators can reference the recommendations to monitor progress or when working to align their team's priorities. All of these stakeholders can use the policy recommendations as a tool for accountability. For the 2023 policy recommendations, BBF has developed a playbook to support moving from recommendations to action. The policy playbook also includes a number of other things to support our network in their work. These include additional context and data to illustrate the importance of these priorities for Vermont's early childhood system, more thoroughly describes the process to develop the recommendations, provides support and guidance for those turning towards the recommendations when writing policy or making implementation decisions, And it also is a tool to support those looking to use the recommendations as an advocacy tool. I think one of my colleagues is going to go ahead and enter the link to the policy playbook in the chat, and we welcome you to take a look at that and use it as a tool in your work. In addition to the playbook, the BBF policy and data team is happy to provide support and technical assistance to anyone interested in taking action on different policy areas, and can connect you with our VCAP committees who can help orient you to the current status of particular recommendations, discuss how we're using the recommendations, and support you in doing so as well. And with that, I'm going to hand things back over to Morgan.
Thanks, Anna. So as we finish our time together this afternoon, I want to invite everyone to take a moment to share in our chat bar one thing that you learned today about the state of children and families, and how you plan to use the report, the recommendations, or any of the materials we provided today to inform your decision-making in the coming year. So the chat bar should now be open. Please share your reflections. And then in a couple of minutes, we are going to transition into Q&A and hold a little bit of time for discussion. So looking forward, Building Bright Futures is going to continue to monitor service provision and outcomes for kids and families across our early childhood system. And it's really important for you to know where to go for that information. So you can head to Vermont's Early Childhood Data and Policy Center at vermontkidsdata.org. And there you'll find a ton of information on topics that you care about, and get connected to some of our key data stores or content experts. The back cover of the report includes a really cool graphic on how to navigate this platform, which is really serving as a clearinghouse or a hub for data, for policy issues raised by the State Advisory Council Network, and a repository of publications across Vermont's early childhood system. I want to thank our panelists today, Paul and Sarah, for joining us. And I'd also like to take a minute to thank some of our sponsors. First, National Life as our corporate sponsor, as well as our funding that we receive from the state of Vermont and our private philanthropic partners as well. In closing, I want to reflect on the state of Vermont's children as we are entering 2023. Today, you've heard some staggering statistics on mental health challenges, on childcare, suspension and expulsion, and housing, among many others. It was also an important opportunity to hear about some of the recommendations on behalf of the State Advisory Council Network, how they can be used in the coming year, and a deeper dive on what's already happening and how we should be thinking about housing for this coming year. And what I hope you heard is that we've done so much as a state to prioritize the needs of kids and families at every single turn, and there's still work left to be done. So my ask of you as leaders and stakeholders and decision makers across our early childhood system is to reaffirm your commitment to improving the well-being of kids and families as setting the foundation for development in Vermont's economy, and recommitting to using evidence and data to informing decision-making. We have such an incredible opportunity to create the system we know Vermont kids and families need, and that change happens with everyone on this call today. So thank you for being here today, and that concludes today's briefing. We're going to pause and then transition into question and answer.